Oh, please give me a minute. Let me make sure this thing is. We are still 25. Hello, guys. I'll give 2 minutes, 2 to 5 minutes for everybody to be here. Eight? No, they don't need to type. I just need to. I'm looking at the number. I'm not looking at the names. You don't need to type your names, guys. Don't worry. I'll just send a pool at the end of the class so that you fill in the stuff. Then I'll get the entire names from it. One minute more. Thank you. I appreciate you guys also. Nian, how are you doing? Sorry, guys. I know you are inconvenienced with me deciding to do this in online, but I really cannot drive, so I had to. Yeah, you're welcome. So we are 51 now. We are supposed to be 80. Okay. So first of all, for people in my class, some of your students sent me a message and told me that Monday will not be convenient for you guys because of the holiday. Like that, they will still be, enjoying the holiday. That Monday won't be convenient for you guys. So, that's we should do it on Wednesday. The exam on Wednesday instead. What do you think? Do you prefer Monday or do you prefer Wednesday? Ah, yes, 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 yes. Let me see how many yes I'll get for Wednesday. Wednesday. Sorry, let me get my glasses. This thing don't follow me. I don't know why this camera away from. Let me get my glasses. The length of the exam. Somebody said, how long is the exam? Doesn't really matter. Maybe 60 minutes or 50 minutes. I don't know. Okay, so I think it will make sense for us to do it on Wednesday instead of on Monday. You understand? So that means for this class, I will just discuss male reproductive system for you guys. Then Monday is a longer class. Monday, I will discuss the female reproductive system properly. And if we have time, we can treat some questions on I'll give you a review for male reproductive system and endocrinology this weekend. I'll give you a review. I'll give you guys a review for it this weekend. Then on Monday, when we do female reproductive system, probably if we have time on Tuesday, I go to my heart, but that Tuesday evening, maybe by 9 o'clock, I can just bring out an hour or 2 hours and we do revision on female reproductive system. I think that will make sense. So this weekend, I'll look for time this weekend when I have time this weekend, and we do male reproductive system and endocrinology review. Then on Monday, we will do female reproductive system class. Tuesday, we will do female reproductive system review. Tuesday night. I'll come back. Tuesday is late, so Tuesday night. This was my recommended work, ma'am, in here. Okay, you're welcome. So I don't know if that makes sense, right? The timeline makes sense. Today we do just complete the male reproductive system and you can go rest, go do your holiday, go eat your chicken. And if you'd like, don't invite me. If you don't invite me, I will have issue with you. I'll just go to Jamaica, you see? Jamaica. Okay. So that makes sense. Okay, perfect. So I will give you the time this weekend, probably Saturday or Sunday. Special senses coming out in this exam or just the final? No, special senses is not coming out in this exam, it's in the final. I think I omitted special senses for you, but I will give it to you during the review, all right? But not this review, not for this exam review. So mind you, the timeline is today we do male reproductive system. Before this weekend, Saturday, Sunday, I'll send you a message. Bring me. So we bring it. Yeah, so please bring it to. So this Saturday, Sunday, we do review on endocrinology and male. Then Monday, we do female. Tuesday, I'll bring out time for you, even if it's 1 hour, so that for us to do questions on female reproduction, so that you'll be very, very ready. But meanwhile, please, I have a reproduction video. All right. I need you to go look at it after this class. Go look at it very, very well. I posted it for you guys. Extremely important. All right. Is it fufu? You could come bring jollof and fufu. Okay. And we are 51 here. You see, that is one of the reasons why I don't like putting classes. As me, all of you always comes to logs in, right? And maybe I come in here, I'm seeing about 80 people. Do you understand? I don't mind. Sometimes I can just fix class online. Like this Monday class now, Monday night, I may decide to, because this thing is really disturbing me. So maybe Monday night I may decide to put it online. But because of this number, that's why I always enforce to come to school. You understand? So you need to talk to your mates, all right? So that anytime we have review like this, class like this or review, they should all be logged in. It's very important. It helps for me as well. So let's jump into what we have today, because before you know it, time has gone. Let's jump into what we have today. I'll share my screen now. We have less than an hour, so I'll share my screen now and I'll finish it. Don't worry. Okay. I believe all of you can see my screen. It's okay. It's okay. Welcome. I see you. My friendest of all friends. Okay, guys. So let's proceed. I don't know where we stopped, but I remember. I hope you guys still remember everything we've discussed about the male reproductive system. All right, from these points, the sexual development, the sexes, the gametes. Yeah. No, it's okay. It's okay. You're welcome. The most important thing is that you're here. Now we are 74. This is better. Then we talked about the internal and external genitalia. I told you about androgen sensitivity syndrome. I told you about the secondary sexual characteristics. I told you about chromosomal determination, the X and Y chromosome, how they happen, how everything happens, the X, and also the embryology. All right, we discussed the embryology. You understand? The mesonephric ducts, the paramesonephric duct, what makes them come into play. All right. That's the beautiful thing about this online, because it helps me to go through things faster. Remember this diagram. This diagram should be at the back of your mind. Snap it, use it to do your wallpaper. Remove his picture or her picture. Use this diagram to do your wallpaper. Extremely important. All right. Because it shows which one degenerates and why does it degenerate. I told you the default setting is female. It degenerates. The paramesonephric duct degenerates when the testis produces what? Testosterone. Extremely important that you know this. All right, and inhibin as well. Okay, we talked about the homologous stuffs, right? Like the gubernaculum and the things that are developed from the same place. We call them homologous pairs. Look at it. Homologous. This is what I'm talking about. Like the penis is homologous to the clitoris. This is a question they will ask you. They'll tell you, which of the following is a correct homologous pairs? And in the option, you will see penis and you see clitoris. All right. It's okay. If you get disconnected, you can always reconnect. All right. So this is where you learn about the homologous pairs for external genitalia. So we did this. We talked about gubernaculum, which is the guide that leads you. All right. The guide, that's gubernaculum. Extremely important that all of you know this. We discussed the descent of testes. We discussed the scrotum and the external genitalia. We talked about the rafts. We discussed the rafts. We discussed the scrotum. When I was telling you about the hernia that I had, then we discussed about the spermatic cord and the scrotum. All right, the things that causes cooling, like the spermatic cremaster muscle, the pampiniform plexus, the datus fascia. All these things helps for cooling. I discussed it with you, and we also talked about countercurrent mechanism. You understand how everything cools down so that the heat, this high heat will not destroy the sperm production. Extremely important that you remember this. Okay, so let's go straight to what we have for today. Okay, yeah, before that, we also talked about the things that produces the fluids, all right, like the seminal vesicle, the prostate, and the bulbourethral glands. During intercourse, this thing produces what? Fluid. We'll discuss them more today. We talked about prostate cancer. We talked about the single corpus spongiosum and the Y-shaped corpora cavernosa. We discussed it and we looked at the diagram. You need to always look at this diagram because it will help you learn more. Remember, anatomy is what? Location, 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 and structure, structure, structure. Why physiology is what? Function, function, function. All right. We talked about puberty yesterday. We talked about the hormones that controls puberty. All right. We discussed everything yesterday. Last week, rather. Is it last week? No, on Monday, rather, on Monday. Then we discussed this hormonal relationship. I think this is the last thing we discussed last time. This hormonal relationship, very, very important for you to know. All right. The GnRH, that's gonadotropic releasing hormone. I told you anything releasing is coming from the hypothalamus. Secretes, the hypothalamus secretes GnRH, which comes to the pituitary, and the anterior, specifically the anterior part of the pituitary. The anterior pituitary produces two hormones, which is the LH and FSH. This LH causes spermatogenesis to happen. Mind you, LH leads to spermatogenesis to happen. All right, you understand, by activating the interstitial cells. All right, then the FSH helps also the nursing cells, the nurse cells. All right, to be able to take care of the sperms that are formed. Extremely important. So this particular relationship is just telling you the feedback mechanism. You understand how everything happens and what stops what. That's what we are trying to tell you. Now, this FSH also produces inhibin. Look at the inhibin. The inhibin stops production of pituitary, anterior pituitary. This is a feedback mechanism. All right. And here, the testosterone also tries to inhibit the production of GnRH. So all these things are feedback mechanism, the things that stops continuous production. You understand? So these hormones are produced when needed. All right. So we discussed this on Monday, so I'm not going to go through it. So I think we are starting from here. So I need you guys to know that testosterone secretion actually declines in male. But in as much as it declines in male, no matter how old that man is, that man can actually, get a woman pregnant. All right. Though there's something we call andropause, which is the male climacteric period. That's period of declining reproductive function. All right. Usually seen around the early 50s. You understand? Testosterone decreases. But despite this decrease, a man can still father a child. That's what you need to know. It's unlike the biological females. You understand? Their own is that once the egg has finished, it has finished. That's the point. It has finished, it has finished. And you know that the egg is predefined. It's unlike men that keep producing, the sperms. Every 60 days, they keep producing new sperms, unlike men. All right? Very, very important that you know. So these are the things that controls the things that controls testosterone, like FSH and LH. Thank you. All right. Some men have things that women have during menopause, like hot flashes, but it doesn't. It's not very prominent. That's why you never hear any man complain of hot flashes. But in women, it's always very, very prominent. When a woman gets to around that age, she starts having hot flashes, suffocation. Like she will know that, okay, this is menopause. But men, it hardly occurs in men. So there's something we call erectile dysfunction. That's inability to produce or maintain an erection sufficient for intercourse. Remember one time I told you people about infertility. Infertility, there are criteria for infertility. You understand? There has to be an erection, there has to be constant sex, and there has to be ejaculation. There's a difference between ejaculation and erection. You need to know these things. And these things has to be adequate for us to say, okay, there is infertility. All right? So you need to be able to have this in mind. And 20% of men in their 60s, 50% of men in their 80s are having erectile dysfunction. A lot of them comes to the clinic. You understand? And we help them out. We sort them out. So let's talk about spermatogenesis today. There are different concepts, two concepts you need to know. One is spermatogenesis. Another one is spermiogenesis. Spermatogenesis. Another one is what? Spermiogenesis. The difference between the two of them is that spermatogenesis is just talking about the entire reproductive cycle of a sperm. All right? The entire productive cycle of a sperm. How it's produced from the beginning till when it matures. But spermiogenesis is just talking about that maturity. All right? I'll show you more as we proceed. So remember, sperm production happens with a seminiferous tubule. That's what they will ask you. 3 events happen. There are 3 things that happen. Remodeling, division, and remodeling. That's the first thing. Reduction of the chromosome number by 1/2. And also shuffling of the genes. This shuffling of the genes helps to maintain what? Variability. All right? That's why you see different offsprings look differently. You understand? Except the ones that, have one egg breaking into 2. That's identical twins. So meiosis recombines genes, reduces chromosome number. You understand? Then produces 4 daughter cells. This is something you need to bear in mind. You need to remember it, like compulsorily. When they ask you meiosis, they'll tell you meiosis does dash, dash, and dash. 3 important things. One is that it recombines genes. It recombines genes, all right? That's for genetic variability. The second one is that it reduces the chromosome. Extremely important. Then the third one is that while producing, that it also produces what? 4 daughter cells. So these are the 3 things you need to bear in mind. So let's talk about this properly. This chart will help you understand everything you need to know. We have prophase, we have metaphase, we have anaphase, we have telophase. All of them 1, 1, 1. This is meiosis 1. So there's meiosis 1 and meiosis 2 division. Now, if you've been in my class when I teach genetics, you will understand whenever you talk about prophase, I told you prophase is preparatory phase, P for P. All right. At this time, everything condenses to form chromosomes, you know, just normal activities. Look at it. Everything just normal. You understand? And often in this prophase, chromatids, they often break and exchange what segments. We call it crossing over. So they may ask you, where does crossing over happen? Crossing over happen in what? Prophase 1. They may not go into details. I say, is it early or late? But remember, it is what? Prophase 1, crossing over. Testicular torsion, of course. Testicular torsion is this one testis, this is another testis, right? The 2 of them can twist. That's testicular torsion. They can twist. It's a surgical emergency because immediately you don't untie it, the testis can die. You understand? Because it's strangulation. They strangulate each other, cutting off blood supply. It's just like somebody holding you on your neck. Yeah, breathing. That's exactly what the testis is doing at that moment. All right. Okay. So that's about it. Now, the second stage is what? Metaphase 1. Metaphase, M for M, M for M, M for middle. So what is happening in metaphase? Look at it. All of them are what? Lining up at the equator. They're coming to middle. Everybody is coming to middle. Everybody, M for M. So tetrads are lying on the equatorial plane of cell with centrosomes, centromeres attached to spindle fibers. But the most important thing you need to know is equatoria, M for M, they are lining up according to their height in the middle. Now, the next one is what? Anaphase. Anaphase is, okay, they break and start going away. Break and start going away. So if they ask you, where do they separate? Anaphase. Telophase is when they go to the extreme poles. That's telophase. You understand? That is telophase. All right. Then in this telophase is overlapping with cytokinesis. They may ask you, cytokinesis overlaps with what? Or telophase overlaps with what? Cytokinesis. Cytokinesis is when the cell divides into 2. So look at it. Pure division. But telophase is when these guys, these chromatids, start migrating to the extreme part of the pole, all right? So you need to know which one happens which. Now, if you notice, this is meiosis 1. Meiosis 1 divides into 2, right? Yes. But it's not done. We said that, if you remember what we discussed here, we said meiosis involves what? Reproducing 4 daughter cells. So if you come here, you see, these 2 will do what? Start breaking. It's as if this one undergoes the same thing. This guy undergoes what? The same thing. And at the ending, they produce what? 4 daughter cells. The same thing. It's just prophase 2, metaphase 2, anaphase 2, telophase 2. At the ending, 4 daughter cells. These 2, we end up doing the same thing here and becoming 4. Chicken, huh? No 2 ways about it. All right? So we have mitotic decision and meiosis. All right? Mitotic is talking about cell, that's body cell divided. You understand? Meiosis is talking about what? The gametes dividing, sex cells. All right? So you need to look at this and understand this very well. So this is exactly what we've already discussed. Yeah, this is exactly what we discussed. Now look at how the sperm matures properly. That's spermatogenesis. This is exactly how it happens. Usually this is basement membrane of the seminiferous tube. Remember what I told you about the seminiferous tube? That is where the sperms are being formed. So this is it. These sperms has been formed. All right? Sperms has been formed. What do? They have to migrate and mature. Remember the maturation, when sperms are produced, immature sperms are produced in the seminiferous tube, right? They pass the red testis. Remember we discussed it. The red testis, that's the network that looks like this, right? Then they now go to what? The epididymis. Epididymis is where they store and what? Mature. That's the process of spermatogenesis. So look at it, you see? They become spermatogonium. Now, I want you to notice something. There are 2 types of spermatogonium. We have spermatogonium A and we have spermatogonium what? B. The difference between the two of them is that spermatogonium A does not move. It just remains in that membrane. So look at it, 2N, remains in that membrane. Now, this is spermatogonium B. It actually moves. It's the one that matures. So spermatogonium B matures, it goes up. These are not cells that's helping to nourish it and make it maintain it. Then this spermatogonium B becomes what? Primary spermatocytes. All right? Primary spermatocytes. Then meiosis 1 occurs. All right? When meiosis 1 occurs, what happens? Remember what I showed you here? Meiosis 1, when it finishes, it gives birth to what? 2 daughter cells. So that's exactly what we have here. Meiosis 1 happens to this primary oocyte, becomes what? Secondary oocyte, 2 daughter cells. You see the two of them? So after meiosis 1, the product of meiosis 1 is what? Secondary spermatocyte. That's the daughter, the product. You should remember this. Now, the secondary spermatocyte does what? It continues into meiosis 2. Exactly what we have here. These two continues into meiosis 2 and undergoes this. All right? So this process, meiosis 2, it becomes what? 4 daughter cells at the end of meiosis 2. We call these 4 daughter cells what? Spermatid. So spermatogonium to primary spermatocyte. So when it is starting meiosis, it becomes its primary spermatocyte. When it completes meiosis 1, it becomes what? Secondary spermatocyte. Secondary spermatocyte enters meiosis 2. When secondary spermatocyte is done with meiosis 2, it becomes what? Spermatid. You see, this is 4 spermatid. This spermatid matures and become what? Sperm. That is, the entire process is called what? Spermatogenesis. Now, from this place now that they become spermatid, for them to become sperm, it is called what? Spermiogenesis. That was what I was telling you initially. So this entire project here, you see this entire project? This entire project is what? Spermatogenesis. But just from this spermatid to this matured sperm is known as what? Spermiogenesis. So if they ask you the question, you should be able to differentiate it. Okay. So this is exactly what we just discussed. So I'm gonna jump this. It's exactly what we discussed. I'm gonna jump this. Exactly what we discussed. I'm gonna jump this. Now let's look at one particular sperm. How does it mature properly? One particular spermatid. All right. Look at its appearance. It has a Golgi complex. It has a chromosomal vesicle. It has the nucleus. It has the basal body. This is its appearance with a very tiny flagella. Did you notice that flagella has started growing here? Started growing. Then here it grows, shedding the excess cytoplasm. It now gets big. Fine boy. You see, it now gets very, very big. This is mature. Looks like a snake. All right. So this head is known as what? Acrosome. The acrosomal head. This is the head that penetrates the egg. Immediately enters that egg, no other sperm can enter that head because it will release one chemical like that to protect its boundary. No other sperm will enter that egg. You understand? That egg can easily break into 2 and become identical twins. But if it is fraternal twins, it means that another sperm penetrated another egg. Can never be 2 of them penetrating one egg. All right? Okay, so that's that. So this is it. The acrosome, very, very important. That's the cap over the apical half of the nucleus that contains enzymes that penetrate towards the egg. Very important. Then we have the midpiece, which contains mitochondria, all right? And the flagella. It contains mitochondria that gives the flagellum energy to move. Remember I told you sperm in the male does not move. That's the funny thing. Sperm in the male does not swim, but when it enters the female, it must swim. It must suffer. It must swim. All right? So this is a mature spermatozoa. You see the head? This is the midpiece, and this is the tail. Extremely important that you know this. This midpiece is where they contain mitochondria. This mitochondria gives this guy energy to what? To move. But this head is the one that contains what? The enzyme that infiltrates the egg. Extremely important that you know this. All right? Now, talking about the semen, we have normal sperm count. We have lower sperm count. If a man in each ejaculation does not produce 50 to 120 million sperms, we say it's the low sperm count. All right? But this is not the only thing we use to consider infertile sperms, right? One can be count. Another one can be morphology. It's appearance. Maybe it's too fat. It cannot move. Maybe it does not have tail. They are immobile. Do you understand? So there are a lot of things that you can see. Like, take your time, you know, and look at these sperms in a microscope, and you'll be able to understand what I'm saying. You understand? You'll be able to get the entire picture of what we are discussing. All right? So there are 60% seminal vesicle, 30% prostate, and 10% what? Sperm. 60% seminal vesicle fluid, 30% what? Prostate, and 10% what? Sperm. And sperm secretions. Okay. Our time is flying, man. Honestly. So look at everything that each of the fluids producing stuffs or accessories, reproductive accessory does. Like the prostate produces what? Thin, milky, what? White fluid. That milky white fluid you are seeing is the prostate that's producing it. It contains a lot of things: calcium, citrate, phosphate. So it's very, very healthy. Trust me. I'm not insinuating anything. I don't know why you are laughing. Somebody is there, like you are laughing. I see you. I don't know. I'm not insinuating anything. All right. But it's very, very healthy. Contains clotting enzymes, is rich in protein hydrolyzing enzymes, a lot of things. Then we have the seminal vesicles, that you know, contributes viscous yellowish fluid, yellowish fluid like that. Very sweet. That's why you know it's sweet. I've not tested it, but if you test it, you know what I'm talking about. All right. Contains what? Fructose, other carbohydrates, citrate, prostaglandin, and you know, a lot of things. Okay. So you go home and check it. Yeah, so another thing you need to know is that 2 requirements for sperm mobility: elevated pH and what? Energy source. The right pH, because it's a protein, and right energy source. All right. So what time is are we supposed to end? Most time I lose the time for this session. Please, can someone tell me what was the exact time we're supposed to, so that I can work with time? Are we here? Yes, everybody. Did I freeze? Oh, 3:20. Okay. I was afraid though. I thought I've frozen and you guys could not hear me. Okay, 3:20. Oh, I have a lot of time. That's good. So 2 requirements. Thank you so much. 2 requirements: prostate fluid buffers. The vaginal acidity should be between 3.5 to 7.5. If the vaginal acidity is higher than this or less than this, the sperm will, you know, disfigure. You understand? Because it's protein. Then seminal vesicles provide what? Fructose and other sugars to the mitochondria of the sperm, right? So it has to move. All right. Very, very, very important. And it produces prostaglandin. It contains prostaglandin. Prostaglandin, right, in the semen, you know, like when you are having sex with someone, the semen will first enter before the sperm even comes. What is it doing? It's trying to provide avenue for the sperm to go through successfully. All right. So it will change the pH of the cervical, the female vagina, so that the sperm, giving the sperm the proper pH to enter. Then it will give the sperm energy to move. Then it will also what? Provide it with a lot of things. Prostaglandin helps to clear the parts. It's just like you take a knife and you are cutting the tree. You understand? Is there something that activates? No. It's just natural. Don't worry. We'll look at it. Humoral. During sex, we'll look at it. All right. Yeah. We'll look at it during sex. Okay. So these ones are just disruptors. Okay. Now let's discuss the I have less than 20 minutes. I have 60 minutes. Okay. So let's discuss the male sexual responses. It's divided into excitement, play, orgasm, and resolution. I know we have a lot of males here. And you are smiling. Okay. So let's see what happens when you have sex. Very, very, very important. First of all, sexual intercourse is known as coitus, coition, or copulation. Anyone you see in your exam, you should be able to understand it. All right. So a lot of things. First of all, you know the anatomy. You understand? Internal pudendal penile artery enters the root of the penis and divides into 2. All right. This artery supplies blood. That blood that enters and makes the penis rise. So we have the dorsal artery. You understand? Travels under the skin. When penis is flaccid, most blood comes from dorsal artery. All right. When penis is flaccid, most blood comes from dorsal artery. Then we have the deep artery. All right, which travels in the corpora cavernosa. You remember the corpora cavernosa? So this deep artery gives off, you know, smaller arteries that penetrate the trabeculae and enter the lacuna of the penis. We will see it. All right. Now, when they enter and fill, they swell up and the penis will jack up. You know what I'm talking about now. All right. So the deep artery is the one that supplies that blood that makes the penis to erect. But the dorsal artery is the one that gives the blood to the penis, even when it is what? Flaccid, when it is obeying gravity. So the deep, if they ask you for erection, deep dorsal arteries. Deep or just deep arteries, all right? Very, very important. Then what brings out blood away or takes blood away from the penis is what? The deep dorsal vein. So you should remember this. This is anatomy. So the penis, now let's talk about the nerves. The penis is very richly innervated, especially the glands and the prepuce. If you touch it, it's very, very sensitive. Just go home and try what I'm telling you. Just touch the cap. We call it cap, all right? That place is very, very sensitive. Why? Because of the rich innervation. Stop laughing. My Jesus Christ. Because of the rich innervation, all right? Aha. Very, very important that you guys know that. And that nerve is known as what? Dorsal nerves of the penis. Dorsal nerves of the penis, all right? Now, we have both autonomic and somatic motor fibers that carries impulses. One is the sympathetic, and another is parasympathetic. These two are very important. Like when you are thinking of sex, for example, I know that somebody is thinking of sex right now. You need Jesus. But when you are thinking about sex, for men, their penis starts rising up. You see my head rising up. That thing that makes it to rise up is known as what? Sympathetics. You understand? It's the sympathetic nervous system that we've already discussed that makes you think, and your penis will start rising up. It induces erection. But parasympathetic is the one, you know, that induces erection when you what? Touch it. When your hand has started palpating, parasympathetic will make it flash up. You feel me? So there are two ways the penis can rise, either by your thoughts, what you are thinking. Yeah, that's why a guy can be walking on the road and the penis will just jack up like this, just because of his thoughts. That is sympathetic. But when it is touching, it is what? Parasympathetic. All right? Yeah, thank you for the reminder. Okay. Now talk about excitement phase. Yeah, it's characterized by what? Vasocongestion. That is when there's a congestion, swelling, blood vessels, blood flows into the distance, and immediately it flows. The penis, the muzzle, there's something called myotonia. Have you seen somebody having seizure? The penis will be having seizure like this. At that moment, the guy's heart will be, the heart rate will increase. Beep, beep, beep. Blood pressure will go up. Pulmonary ventilation. That's how it happens, right? I don't know. I'm not experienced in this area, but I feel that that's how it happens. All right. So, what really happens in this excitement and plateau phase is that the bulbar urethral glands secrete what? Fluid. You understand? And that fluid is secrete. You understand? We cause what we call what? We become what? The erotic what? Stimuli. And immediately, the parasympathetic will trigger what? Nitric oxide. Mind you, nitric oxide. This is what is primarily responsible for that erection. All right? Nitric oxide. Then the arteries will dilate. Immediately they dilate, blood gushes in and fills the lacuna, leading to what? Vasocongestion. Very, very, very important. This is why, at that moment, if you ask that the man for his ATM card, his credit card, he will give you that credit card at that moment. This is exactly why. All right. So erection allows for what? Intromission. That's entry into the what? Into the vagina. I have 10 minutes. Okay. This class is too short. It's not allowing me to talk, but it's okay. Then we have the plateau state. Plateau state is that place is the height of it. The respiratory system, the heart rate, the blood pressure still remains increased. But at that moment, there's what? Max increase in what? Vasocongestion. Plateau. All right? Like the person is firing at all cylinders at that moment. So I need you guys to look at this thing. Okay, before you look at this, let's talk about the orgasm phase. The orgasm phase or the climax phase. That moment is intense. You know what I'm talking about. Stop laughing. That moment is intense. So it's a short but intense reaction that is usually marked by a discharge of semen. You will see the person will be shouting. The body will be moving. His face will be, no matter how pretty that guy is, his face will be somehow at that moment. And it just lasts for 3 to 15 seconds. It's as if you are frozen. You understand? Everywhere, myotonia, right? The heart rate is increased, the blood pressure is increased, breathing is increased, everything is increased at that moment. That's what we call what? Orgasm. Huh? Aha. And after orgasm, we have what? Ejaculation. Ejaculation, there are two stages of ejaculation. We have emission and we have what? Expulsion. Emission and expulsion. Emission is usually when there's peristalsis, which propels sperm through the ducts. All right. Now, expulsion is when it move from that duct to outside. That's expulsion. All right. So ejaculation and orgasm are not the same, but they usually occur together. At that moment, when that guy is having an orgasm, the person is ejaculating at the same time. All right. So if you look at this diagram, let's go back to this diagram that I wanted to show you initially. This is the excitement phase. The excitement phase could be caused by what you see. You see something, it affects your spinal cord. Immediately, the spinal cord gives information to the pelvic nerve, and your penis starts rising. Or it can be that somebody stimulated you, somebody touched you. You know how you do it. Touched you, and immediately the internal pudendal nerve carries the information to the spinal cord, and the pelvic nerve, which is efferent, causes excitation. So you need to know which one is the efferent and which one is afferent. So this internal pudenda is the afferent, right? That carries information when you touch the penis or touch the person. But this one, eyes, this one is visual, right? The stimuli just go direct, through your visual pathway to the spinal cord. So that's exactly what happens here. Now, here is after this excitement phase, we have the orgasm and emission phase. All right. See the spinal cord, sympathetic nervous system causes, everything to the prostate to secrete, the prostate secretes fluid, right? First of all, before even the men's sperm start coming out. Why? Because you need to create pathway for the sperm to come in. After that, the semen enters the ureter. You see it? Then that's another stage of orgasm. Then from there, we have the resolution phase. I hope you guys understand this thing. Now, let's talk about the resolution phase. This resolution phase is anything that goes up must what? Come down. All right? Resolution phase, everything returns to normal. Sympathetic signals constrict internal pudendal artery and reduce blood flow. Penis becomes soft and what? Flaccid. Yeah? At that moment, the penis is what? Flaccid. Everything, the cardiovascular system, the respiratory system is back to normal. There's something we call refractory period. Refractory period is, as far as that thing has fallen, there's nothing to do it that it can rise up at that moment. It lasts for like 10 minutes. No matter where you put it, no matter how you touch it, no matter how you stimulate it, you understand, it will not rise. It has fallen, it has fallen. You understand? Till around 5 to 10 minutes. Sometimes some people maybe less than 5 minutes. All right. Somebody was telling me, no, my boyfriend does not have this refractory period. I say it's not true, except if that person takes something. All right. Even if he takes something, says what can somebody take? Viagra. How does Viagra work? Let me just show you the diagram. Look at how Viagra works. All right. First of all, sexual stimulation produces nitric oxide, which we've already discussed. What does this nitric oxide do? Nitric oxide will activate the inactive guanylate cyclase. You must remember this thing. It will activate it. The guanylate cyclase will become what? Active. This guanylate cyclase will convert GTP to CGMP. This CGMP is what causes what? Vasodilation and erection. Does it make sense? Erection happens. Exactly. Thank you so much. Now, this CGMP, there's something we call phosphodiesterase. Phosphodiesterase will start breaking down this CGMP. You understand? Degrading it. And when this CGMP is broken down, it will lead towards loss of erection. So if you see those people that their penis cannot rise, it's just because the phosphodiesterase is always any little CGMP that is formed. Phosphodiesterase will break it down. So this Viagra, what it does is that it will inhibit that phosphodiesterase. So when the person is stimulated, nitric oxide stimulates inactive granulate cyclase to active granulate cyclase, converting GTP to CGMP. What happens? You have erection. Now, this Viagra will stop this phosphodiesterase from working. That's why we call it what? Phosphodiesterase what? Inhibitor. It inhibits phosphodiesterase. So Viagra, Levitra, Cialis, all of them are what? Phosphodiesterase what? Inhibitors. If you can understand this thing, when you do pathology, you will understand pathology of reproduction. All right? And I will advise all of you, immediately after this class, go look at the reproduction video. Just take your time. It's just an hour plus. Look at it from A to Z. Oh, my camera disappeared. I didn't even know. Don't mind this camera. It's following my hand. As I did my hand like this, it just went away. I don't understand. I hope you guys understand what I'm saying. Thank you. Thank you. So the you guys should go look at that reproductive video. Immediately. Don't wait. Don't wait. Answer the questions. Then Saturday, Sunday, I'll fix a class. Let's review this particular thing. We can't see. Can't you see me? Can you see me now? They work if only it's simulated. What are you asking about? Okay, yes, you can see me. So I hope you guys understand this particular one. Okay, now remember STDs. There are different STDs. We have the chlamydia, we have gonorrhea, we have syphilis. And I was teaching you guys about gonorrhea before. I told you guys that gonorrhea is causes pain post discharge. All right, how does it cause pain? Gonorrhea will enter the hole, eat it up, eat it up, eat it up. You want to urinate, you pour urine. Urine contains what? Salt. That urine will enter into that injury, and you will start shouting. And also, it causes pus. So whenever you are putting something in your mouth, please know what you are putting in your mouth. Press it first and know if there's pus coming out before you take it and go and put it in your mouth. All right, so that you don't have gonorrhea in your throat. You understand? So we also have chlamydia. You understand? Can also cause discharge and pain. Somebody is laughing. Is it because I said put it in your mouth? It's true. Don't do it. Look at what you are putting in your mouth. Press it like this. And know if something is coming out and know the color of it. You understand the point? Something should not be coming out. Say Jesus. I am serious. Okay. Of course, because some guys, they have these things. A lot of people have come to the clinic with a lot of throat infections, gonorrhea in the throat. You understand? And it's because the person, they don't check it before they put it wherever they want to put it. Please, I don't even know what I'm talking about. Now, syphilis has different stages, guys. All right. We have the disappearance of the chancre stage. We have the second stage, which is widespread pink rash. We have the third stage, which causes damage. Sometimes women may have some of these things, but they will not know. They usually know when it ascends. There's something we call it ascending infection. It ascends to the pelvis. You understand? The lady comes to the hospital with bilateral pelvic pain. You understand? That's what we call what? PID, pelvic inflammatory disease. All right. So some women don't know. If it doesn't ascend up, they will never know. All right. And if you give birth with some of these things, it affects your child. If that child comes out vaginal, it affects the child. All right. Okay. So these are virus STDs like genital herpes, genital warts, hepatitis B and C. All right. So you guys should do well to look it up. Anybody has a question for me? I have how many minutes? This is 3:18. I have 2 minutes. Anybody have a question for me? Okay. No, good. Okay, so that means you guys understand everything very well. All right. Please, I will beg you again. Go and use that video, the reproductive video, and look at the questions. There are a lot of questions I discussed there from beginning to end, and especially at the ending. Very, very important. If you've not subscribed, try to subscribe to this channel because I'll be also treating microbiology here, pathology here with time. All right. And I'll create a community on YouTube for people that are interested. So please, if you have any question, come back to this particular video will be on the channel. So put your question there. You understand? And any video you watch, at the end of the video, just write ready. I really need that comment. It shows me that okay, so and so person has watched that video to the ending, and the person is already ready for the exam. So just at the ending, just come on the comments. Even if you don't have any question, just write ready at the end of the entire thing. All right. So thank you guys very much. I think it's time. I will leave you guys to go. I'm not taking attendance for today. I think I'll leave the attendance for Monday because I see that assuming you guys are not up to 60 now, then that's where I'll take attendance. But you guys are almost 70, and I'm so happy that you guys came around. Thank you so much. Yes, happy Thanksgiving. When you are eating, eat for me. Oh, you bring 2 chicken, you eat your own, and you say this is for the professor, and eat that one for me. All right. Okay. See you guys. Enjoy your holiday. Enjoy your holiday. Do your assignments. Don't forget within the weekend. All right. So your exam, please try to put it in your class WhatsApp group for people that are in my class that the exam is on Wednesday, not Monday, because I know that they will start flooding information. If my leg is good by Monday, then we will do the class in person. I like seeing your faces. You understand? If it's not, then we'll do it online. But for me to do it online, you people have to promise me that we will not have less than 70 people. You understand the point? Okay. All right. See you guys later. Take care. Thanks so much. Thank you. Yes. Happy Thanksgiving. Thank you. Yes. Confirmed. Wednesday. Yes. Tell everybody. Yeah. Well, the online will depend on if I can get the assurance that we will have more than 50 people here. But if we're having 30 people, then it doesn't make sense. It doesn't make sense. Just write ready, when you finish. Yeah, just write ready. Yes, it's still bothering me. Oh, it's really bothering me. Like today itself, I don't think I can drive. I'm supposed to go to school today. I'm supposed to go to the lab today. But I really think no. That means you were not here all along now. You are just coming in. I didn't take attendance today because people were up to 70 today. That's why I didn't take attendance. It doesn't make any sense for me to take attendance. But assuming I waited and people were not up to 50, I would have taken the attendance. It's very easy for me to take attendance. Yeah, I'll just put a poll, and all of you be clicking on it. Yes, I would have just put a poll, but you guys were up to 70, so no need. I assume everybody came. You're welcome. You're welcome. Thank you. Take care of yourself, eh? You guys should have a great weekend and a great celebration. Bye-bye. Yeah, same here. Same here. Thank you. Thank you. Try to go watch the video later and put ready, all right? Yeah, thank you so much. Fed. Thank you.